Hello, cultivators. Hello, everybody tuning in today. My name is Steve Garguilo, the founder and CEO of Cultivate. Cultivate is a talent development studio that focuses on supporting talent, in particular in high stakes situations, high stakes scenarios. Today, we're going to be talking about high stakes teams and how we support teams, which is a really exciting aspect of development that so often we focus on individuals, but getting a chance to focus on how individuals work together in a specific context towards a specific outcome, I think is a really great thing to get to chat about. And I'm joined by two of the foremost experts on teaming. I'm going to allow them each to introduce themselves, but I'm joined today by Tracy Roe from Thermo, and I'm joined by Wendy Ammirato from Change by Connection. And so, Tracy, thank you so much for joining us today. Why don't you give folks just a tiny bit of your background, and then Wendy will give you the chance to do so as well.
Of course. So hi, everybody. I'm Tracy Roe, a Vice President of Development Operations in our Clinical Research Division, formerly known as PPD, and we're now part of Thermo Fisher Scientific. I've been in the industry now 28 years, all in the clinical research side. So I'm looking forward to this collaborative discussion today.
Hi, everyone. I'm Wendy Ammirato, and I am the principal owner of Change by Connection. That's new. I recently went out on my own. I've spent 2 decades in the pharma industry. I will not tell you the number of years because Tracy's younger than me, so I'm not going to do that. And that's been in various venues and various sponsors and sites in different places. And I think that's important because that's the different dimensions that you bring to trying to bring a research project forward. I recently left a large organization where I worked closely with Tracy, and we were able to really build a very strong teaming environment. And that's where we met Steve, because he was a part of that.
And that's something that we all share, right? So I spent about a decade at J&J, and I've spent a lot of time working with a lot of big pharma clients. And Wendy has a lot of big logos on her resume as well. When you look her up at AstraZeneca, Takeda, a number of very large organizations. And so I think what's great about this kind of teaming is when we talk about supporting teams in a clinical setting, it's not supporting teams in theory. It's not supporting behaviors that might show up someday. It's supporting things in a super high stakes environment. And so when we talk about some of the work that we've had the chance to do together, we're talking about supporting phase 2, phase 3 clinical trials where those cost $30 million a month to run. And if we're getting enrollment done ahead of schedule, if we're doing things in a way that's actually saving money, we're talking about significant outcomes. In one case, right, on one study, $90 million of savings of getting that site enrollment done ahead of schedule, having zero turnover in a year over the course of a whole program, leadership receiving zero escalations, which we know these kind of things are unheard of in our industry. And I think some of these things are really incredible outcomes. And so that's why, in particular, I wanted to deep dive together on how are things like that possible? What are the things that we do to set up the chance that we could have those kind of outcomes? So I thought, why don't we start at the beginning, right? So if we think about a high stakes team, and in this case, we'll talk about clinical trial team, right? And for those of you tuning in who aren't as familiar with how clinical trial teams work, oftentimes it's the case that you have a team of mixed badges. You have a team from a biopharma company who has either developed or acquired a molecule and says this is a promising area of study. And then in order to execute on that study, they involve a clinical research outsourcer and involve someone who can actually help do that, set up that trial. And so you have a lot of potential for maybe things to go wrong, like you would in any team where you have people with maybe in some ways sometimes different motivations. You have people that maybe aren't trained in teaming. In a lot of these teams, you have people who are hardcore scientists who maybe would just rather be sitting at their desk and doing the science and not have to worry about teaming. So if we think about that context, Wendy, what are the things that at the outset of forming a new team are things that you think about and things that you've done to make sure that before the team is even formed, we're starting to do work that can make a team successful?
Yeah, so the reason I focused on teaming is I noticed that all of our teams had the same access to resources, SOPs and digital and data and tools, and yet they had very different outcomes in their projects. And some of that could be specific to the project and what they were studying and the patient population, but the variability was really glaringly obvious. And a lot of it came down to the people and how they work together, and it's a soft skill. So I often say the farm industry is a hard skill industry. We want KPIs, we want metrics, we love process, we love digital and data. We don't talk about people connecting and knowing, expressing their expectations and aligning on how they're going to work together. That seems sort of soft and it doesn't get a lot of attention. And so we tend to spend all this time planning our projects. We're going to do it this way. We're going to go here. We're going to go there. And we do very little helping that team form up their ways of working. We sort of hand off the mission and say, go forth and do it. So what we learned was being very intentional in the beginning, even in choosing your team members. Are they the right fit for the team? And then allowing them to form, storm, and norm in a very intentional, specific way. Hoping that you get a great team is not a strategy. Knowing what a great team looks like and what skills, disposition, and mindset they have, you can inform and actually bring that to life by being intentional in the beginning. So to me, that's why the teaming is important. We spend all this time and money on the project, and that's all well and good. But then you hand it off to a team that you don't empower to be high performing right out of the gate.
And Tracy, what does it mean to actually be intentional about selecting team members? Because maybe some of the skeptics watching might say, when we partner with a CRO, whoever's on the bench is whoever we're getting, and they're just going to kind of slot them in. Like, what is your experience around like how you can actually be intentional about forming these teams?
I think it's about understanding, what the expectation is. So for every single type of work that we do, there's a different expectation. There could be something that's very high touch, which drives, significant acceleration that will require a team that is fully dedicated, whereas you could have something that's sort of spread out a bit longer. And I mean, when you're selecting that team, you need to make sure that they understand the fundamental elements: trust, collaboration, transparency, sharing the same work goals, understanding that we need to deliver and that we're on the same team. That one team mentality is critically important.
Well, and one of the things that I've been impressed with in noticing how you and Thermo Fisher set up these teams to partner with your biopharma partners is you actually talk about those things before the study even starts. So you spend some time setting those expectations, you spend some time learning from past examples of success on studies, and you say, this is how we are going to show up for this partner to make sure that it's truly a partnership, right? One of the big things we talk about that I hear both of you talk a lot about is partnership versus vendor, right? So we really think of it as a partnership. We really think of it as one team, one dream. Can you share a little bit more about that?
I mean, and I think that's the secret sauce, is that, you need to move away from this vendor customer, type of mentality, and understand that you have to be working on team. And so for us, it starts very early on. You receive a request for proposal, you're already identifying what the needs are, for that particular study or that particular program, and then understanding the people that you need to assign. And then from there, an early strategic kickoff, getting everyone in the same room so that they can openly discuss and collaborate together, and understanding that they're going to be doing this together. It's not one person's success, it is everyone's success. And so that brainstorming, spending that time up front, really enables everyone to be successful and move things forward from the onset.
And when we think about like a team leadership, so if we go from kind of the ethos of how we select a team to now we've selected a team and we've selected leadership of a team, in these types of teams, when we're talking about like clinical operations, I feel like there can be this misnomer on teams that it's always super clear that there's a leader, like there's a president and a vice president and a secretary and a treasurer, and there's kind of clear lines of authority and leadership. In these teams, there's a lot of variability in terms of, okay, you have a clinical operations lead, but then you might have a site lead and you might have a study lead. There's a lot of different leaders. And I'm curious, Wendy, how you think about like when you're setting up team leadership and it can look different on every study. I guess, how do you define what leadership means on a team, and how do you think about setting up the leadership of a team to be successful?
Yeah, so I think leadership is shared, if I'm going to be really honest with you. People can have a title and people can have races and roles and responsibilities and who's accountable. And when I have teams that start pulling out documents to solve their problems, I know I have a bigger problem than not, because I'll often say to them, a document has never solved the problem for me. It's a guidepost. It's an instruction to take a look at. And so there does have to, at the end of the day, what I call the decision maker, which I guess is the ultimate leader, because I find so many teams get stuck in this. It's not my job, it's your job. Let's look at the RACI, let's look at the SOP. Your SOP is wrong. Well, everybody has a different opinion. And so what I will say to the ultimate leader, which is defined by whatever operating model we're working in, and it's co-leadership, right? The sponsor and any vendor partner, they have to have an equal voice, because the second you have sort of a master mindset, or you just are an extra pair of hands, do what I say, you lose all of the great energy that comes from everything they know. So what I'll say to folks is listen to each other, have a speak up, listening culture, listen to everybody in the room, and then the person who's the decision maker takes the decision. They have to be the one who takes it, but then they have to give the dignity and respect to the team to tell them why they took it. And a lot of people don't do this. I heard you all. Here's what I heard. I know I didn't, we're not doing this, this, and this. Here's why we're going where we're going, but I want you to know I heard you, and that when I sorted everything in the end, this is where we landed. But leadership is shared. When you think one person is going to lead everybody everywhere, even from both sides, it goes wrong. Everyone needs to own their own part of being a leader for that team and doing what needs to be done in that moment to succeed. So I don't like to get caught up in academic leadership conversations. I like to get caught up in team norms and community values and lead from where you are. But respect that ultimately there's a decision maker and someone at the top of the chain, but they can't and won't do it all. I also tell those leaders, their behavior, their unconscious, when you don't think anybody's watching, behavior matters immensely. And this is in whether you're a true partner or you're acting like they're an extra pair of hands. If you show true collaboration, true accountability, if you are authentic as a leader, that has such power for a team. And it's the most important thing you can do as a leader.
Yeah, for those of us who've been lucky enough to work with Wendy, we know Wendy has a lot of Wendyisms and sayings that you like to bring into these conversations with teams when you're motivating them and holding them accountable and working towards study success. And one of my favorites is, don't get mad, get curious, right? But it's also like, don't get apathetic, get curious, because part of leadership is not throwing it over the fence and just hoping somebody else will resolve it, but it's taking that personal responsibility to say, I'm deeply invested in this study success, and I want to make sure if there's something I don't understand, I need to understand it and work towards it to make sure that we're not running into a situation, right?
Exactly. And that the book Extreme Accountability, and I know it's written by a guy who went into combat, but there's not a much more difficult situation where being a leader is important. And really what I took away from that book is, what can you do in the moment to help that team succeed? Don't start pulling out races and swim lanes and it's not my job. Definitely collaborate together, but take personal accountability to say, we need to get this done. And I love all your points about productivity and cost savings, but to me, the North Star is always the patient. Patients are waiting. Some patients are running out of time. So while we're mucking around, people can be losing their opportunity for a better quality of life or to even have a life. So that's another North Star I say to folks, like, please remember that that's the end game.
And Tracy, how do you think about leadership from your perspective, where you're supporting a broad portfolio of clients and you have, various studies happening at any given time, and you're trying to hold leaders accountable to care as much as you do? Because I mean, I've known you for years and I know how deeply you care about patients and how deeply you care about this. When you're trying to set up leaders for success, what's the advice and the guidance that you give them? Because there is a power dynamic here, right? And like, how do you frame it? How do you help set it up so that that power dynamic doesn't result in issues?
Yeah, I mean, at Thermo Fisher, we're all in this job because we want to bring a better life and medicines to our patients. That is fundamentally what we all want to do. And from a leadership perspective, we always have an infrastructure, because you need to have an infrastructure to be able to help build the team dynamic. But it's all about, working together. It's all about that ongoing collaboration, because there's no I in this job, there's we. We've got to be successful, and we do that as a team, regardless of whether it's in one organization or as if it's across many, because we work with vendors, and we work with with our customers, and then we work within different divisions to be successful. And everything is all about collaboration, trust, really making sure that we're listening to one another, understanding what needs to be done, and the leaders are there to support and assist when needed. But everybody is an equal when it comes to being able to deliver these critical projects and these life-changing therapies to our patients.
Mm-hmm.
So let's talk a little more tactical. If we can talk a little bit about some of the work that we've had the chance to do together, right? Where, all right, you're setting that level of accountability, you're setting that infrastructure, right? You're putting stuff together so that the team can be successful. What does it look like to actually kick that off? Can you bring us in a little bit to what we've done in terms of hey, we do a kickoff for the leadership. What are the kinds of things that they're doing there? What does it mean to do that kind of stuff? And maybe Tracy, from your perspective a little bit, and would love to hear from Wendy on it too.
Yeah, I mean, you're setting the strategy from a kickoff perspective. You're understanding, exactly what we need to achieve as a group. And so you set the initial strategy, but you need to understand that, when you're in that room together, you're strategically thinking about what can we do and how can we do things differently to be successful? How can we accelerate but not risk quality? How can we understand what we need to deliver, but make sure that we're staying within, the cost boundaries that we have, because there's a cost element to this as well. And so everybody is in the same room, and they are strategically thinking about, how we're going to do this, being able to listen to one another, being able to be involved, being able to ask the right questions, and not being frightened that it's the wrong question to ask. It's having that open forum, and being able to partner together. And I think that word partner means everything to being successful. And that's what we've done, with the support of Cultivate.
Yeah, so I totally agree with what Tracy said. To get sort of maybe one level deeper in the onion of, well, what does that look like? We spend a lot of time being very authentic in those meetings and bringing the elephant in the room, or talking about the elephant in the room, right? So we'll talk about a scenario where there's the power imbalance that you raised, Steve. That can really derail a project if you don't sort of acknowledge and talk that through and reach some agreements amongst the team that there will be a speak up, listen in culture. That's not going to just organically happen on its own. It needs to be intentionally talked about. It needs to be intentionally set up. Sometimes you'll have team members who take championship role. If we're not being our best self, listening to each other, I'm the one who's been voted by the team as having the right to raise my hand and call us out and hold us accountable, because no matter what program we run, we can't be in the room with them 24/7. And the goal is self-governance and to put the right skills and mindset and dispositions in the room. So it really is important to talk about that from both sides. And that's to encourage the partner organization to have a voice and speak up, because some of them have had bad experiences. There can be a little PTSD from the past of, well, it really didn't get me anywhere, so why should I do that again? And acknowledging that, you can start seeing the heads nod around the room. You can feel the oxygen come back into the room. You can feel people feel safe to talk about it. And also, having lived on the sponsor side, to say, not listening to them is hurting your own project. It's not going to make the problem go away. It's not going to be, unless you have a self-solving problem, which I've found very few of in my life, it's not going to just naturally dissipate and go away. So it's in your best interest to really listen in, to really hear that bad news. It may not be what you want to hear, but ignoring it isn't going to solve it. It's like conflict. You've got to put it on the table, talk about it, and work it through. And I think, Tracy, that's what we've done in a lot of our kickoffs, is when we as leadership show the willingness to be vulnerable and talk about the stuff that goes wrong on teams and the relationship problems that we see every time on different teams. It makes it safe for them to say, well, if leaders get it and they can talk about it, and we invite them into the conversation. I think that's where the bonds are built, Trace. I don't know what you think, but
I
that's what I
agree.
was
I think
thinking
it's
while
that
you were
safe
talking.
space. Yeah, I think
Exactly.
that's absolutely right, Wendy. It's having that safe space and encouraging them to know that, you know, they can openly ask questions or share things, even if they're worried it might be perceived wrong. We're in a safe space, and the only way we can address it is to openly discuss it.
Yeah. And sometimes Tracy and I will help them coach how to say it, right? Because sometimes it's not what you say, but how you say it. So it can
Yeah.
be perceived as you're the partner. Why are you telling me my business? So we massage the messaging, and that's not being unauthentic. It's just choosing to say it in a way that it can be heard and received and acted upon. And that's a lot of the coaching I think we do, and encouraging your team. Like, don't stay in a corner stuck and just wait for the train to hit the brick wall. Raise your voice, because it's going to be ugly when the train hits the wall. It's going to be uglier than raising your voice now. But it's a process. It's a nurturing, it's a coaching, it's leadership showing the way that it's okay. And it's not only is it okay, it's necessary to talk about these things.
Well, and from my experience with clinical trial teams, it's more typical that at the outset, what do we do? We set up a strategic plan, we set milestones, we spend all the time in the work, which is critical. But we're so focused on those things that we don't take a step back to think about how the work will get done. And so what we've been able to do on our teams is focus on having what I call the gift of time to focus on how we will work, the gift of time to focus on how we will show up as a team to support each other. And so to say, we're going to invest a half day or we're going to invest a full day just to focus on that, to say, what are our operating norms going to be? What are our expectations going to be? What's our safe word for, an escalation, to know when we're not on the same page that we can call that out. One of my favorite anecdotes from a participant in one of these programs is she said, oh, I finally got a sense of how people type, almost that sense of like, how people talk, that shorthand, like, oh, I'm getting that little bit of a sense and building that trust and building that relationship. So I'm not immediately reacting to an email and saying, oh, well, that person hates me. Well, screw them. Like, I'm about to go get them on my end by kind of getting my boss involved. And when we know in these situations, you never just get your boss involved, you get 7 other bosses involved. They all get pulled out of stuff. I don't know, in your roles that you're in, you set out and you have like, this is what my week is supposed to look like. But if you're supporting a bunch of studies, the week gets so disrupted because of all these escalations, right, that start with a little thing that could have been resolved if we had just talked about it up front. And so I think of this almost as like, as someone who works in talent development, it's almost like the holy grail of talent development, because what are the things that make for awesome talent development? It's real behavior change. It's real business impact. It's shared accountability and being able to do things together, right? And so often we're trying to check as many of those boxes as possible in a development experience. But wow, when people are like in it and they're in the fire of like working on a team, and then they have to do this kind of work together, it's really just the perfect cauldron of circumstances for people to have the chance to say, yeah, I'm going to be the best teammate I can be, and I'm going to learn the skills required to be a great teammate, every time I have an opportunity to do this work in the future.
Yeah, we call that cascade chaos. That's my little tagline for that. I just told one person, and then, it's blown up. And the amount of time that takes. The other thing is, when we first were pitching, kudos to Thermo Fisher for believing in teaming and partnering with Takeda to do this. We said, go slow to go fast, right? Go slow to go fast. Our intensity is, we've got the plan, let's run off to and do it. But taking the time to set yourself up for success saves you all that crisis management, which we spend so much time, money, and energy in. We're pulling cars out of the ditch all the time, and most of it comes back to having an element of team dynamics involved in it.
All right, and so we do an amazing kickoff, right? And we've gotten to peel back the onion on that, which is great. So we set a team up for success by making sure that they have a chance to think about their norms and kind of the way they're going to work together. Tracy, once we have a great kickoff, does that mean we're done? And like, the teams are going to be great?
No, absolutely not. We need to continue this momentum. So, we need to have regular touch points with the joint teams, and also to have a mechanism, where we can allow them to provide ongoing feedback and make sure that they're being supported. And I think that mentoring, that ongoing support is critical to seeing this through. We can't just stop at the kickoff stage and say, you're done, you need to run with it now. We need to continue to support and provide that dialogue to them. And that's what we've done in the past, and it has proven to be completely successful.
Yeah, it's not a vaccination, right? One and done, you're going to get your antibodies, you're good to go. And that's been the really labor intensive part of the relationship we've built over the last 4 or 5 years, right, Tracy, is that we've been in those meetings and doing that coaching and nurturing in real time, but now we need to make it scalable and transferable. We really need to grow high performing empowered team members who can go from team to team. And yes, they'll still need to set themselves at the start, but they're going to come as this fully faceted team player, and they're going to bring that on every journey. And so that's the stage we're in now. How do you, one, get real-time feedback? How do you coach and mentor? How do you grow that? And then I would be remiss if I didn't mention managing team health. Too many teams don't do it. Every team I talk to, I'm like, do you talk about it? Do you measure it? Do you even know? Oh, you talk about it at the water cooler and about each other, but you're not actually talking about it as a team and strategizing how to improve it. So that's another component that I think is still another stone on the journey.
Yes.
Yeah, and kudos for investing in that, because it's already, enough of a hurdle in some cases. Who has extra money laying around right now? Who's just like, hey, we want to throw more money at studies, right? Everyone's under budget crunch. Everyone's under pressure. I know when you're negotiating at the pharma CRO level, there's always a lot of pressure on that. And so being able to make the case to say, hey, we not only want to set up the team for success at the outset, but we want to maintain that, is so important. Because I think with the best of intentions, people think, oh, if we invested in some kind of team building activity at the outset, we've kind of checked the box on the team, right? But even with the best of intentions to say you've checked the box on the team, in what world does just setting something up at the beginning, set it and forget it, in what world does that actually work, right? We need to be able to come back and have that shared accountability around, well, how is it working and how are we doing, right? And I like that, in the studies we've worked on together, we've seen that happen in 2 ways. One way is just these team check-ins, right? Where it's a chance to say, hey, it's been a month. How are we doing? How are we showing up as a team? What are we doing? What have been our lessons learned? Are there things here we need to adjust, right? Because it can be the case sometimes we make these team charters and then we never look at them again, never reference them again. So just having that monthly check-in to say, how are we doing? What can we be doing better? So that's one piece of it. And then the other piece of it is coaching, right? And having this one-on-one coaching to say, hey, anywhere where it looks like there may be some emergent issue, where there may be some kind of dynamic at play that doesn't look like it's 100%, let's get a coach in there right now to work to start to resolve it, right? To start to look at the root cause and some of those kind of underlying issues so that we can nip them in the bud. And so I'm curious, Wendy, what did you see come out of those check-ins, out of that coaching that kind of helped keep teams healthy?
Yeah, so I think the check-ins are important because we're on a journey, right? Our journey is to get high-performing, empowered team members who can move from team to team, and also to build in internal coaching, right? Because the reality is coaching in real time is the best of all things. I always use the sports analogy. How many coaches' eyes are in the sky feeding into the quarterback and this one and that one, and they're making adjustments in real time. So that eventually is where we want to go, right, Steve? We want everyone to be able to do that. But in the meantime, we're an industry that doesn't look after our team health, that doesn't look after our teaming, that doesn't really acknowledge that this is an important thing to do. So at this juncture, I think teams having almost, I think of it like respite care. I used to be a nurse. You get some time to just take some time and decompress, talk about it, and get that coaching in real time, because sometimes you can't even see the problem for yourself, if that makes sense. You can't see the forest for the trees because you're in the forest. And so when the team sometimes just chats about what's bothering them and what's getting in their way. Simple questions. What's going really well? What's delighting you? What's in your way? What's between you and success? The stories they share allow you to help them see, oh, well, there's a dynamic in there. There's a power imbalance there. There's this. And then role play with them how to manage that. So I think that just a chance to pause in the race and take a breath and talk about how it's going. Venting your spleen is helpful for anyone, anytime, anywhere. But using that session to see patterns and trends and offer insights is very valuable.
And Wendy, you've told me this story that has stuck with you over the years from AZ's CEO, talking about the impact of that, of when we have that adversarial relationship and we feel like, yes, we just won them over. And it's like, well, actually you didn't. What is that story?
You mean my AZ CEO story when he walked in and told us how bad we were in the nicest possible way? We had our first American CEO. I won't name him by name, but he was brilliant. And he called all of his top R&D leaders in the room and he put up the top 20 development times, performers, and we were number 20. And he announced that we were number 21. And then he paused for a full minute. That's a really long time in a big room with a lot of people. And you're thinking, who's going to tell him he got the number wrong? And then he said, I know I employ tons of smart people, and most of you are in this room. I know that I said 21 because we're only 20 on our best day. And this is unacceptable. Our patients are waiting. We need to be better. But here's the good news. We've looked at why we're not. We can't take a decision. When we do, we can't hold it. So taking decisions in the face of uncertainty, managing conflict and not going for consensus, which is very time driven and isn't always necessary. And he laid this out and then he told us, and we've worked with Harvard to send you in cohorts across the whole organization. So how many of you have met somebody from your company you never met before, introduced by someone at a conference who's from a different company? So the point of it was his leadership was shining so bright in that moment because he had the courage to tell us something that was hard to hear, but in a way that he then made palatable for us to hear it and offered a solution to act upon. And I'll tell you, most of what I've baked into all these programs through the years comes from that experience because they did an incredible job. They got engagement, they got productivity, they got vulnerability, and they taught us the skills to survive in the VUCA world. They were ahead of the curve because this was the early 2000s. And I see companies now who are still struggling to figure out they need to do that. So to me, that's the leadership shadow because a lot of times these things are done by HR, and I love my HR colleagues. I want to say that, but they're a helper. They're a facilitator. They are not the person that people look to as their leader, whose view matters, whose opinion matters, what they care about matters. And so it comes back to the best transitions I've ever seen are when there's a leader who's willing to march into hell for a heavenly cause and really stand firm. And people then took that up and they're still paying dividends. They're a great company. And I think part of their ingredients are that.
And wasn't there, I don't know if it was from the same leader or someone in that tree of leaders, a story around like people who were so happy that they kind of got one over on the CRO and they negotiated for some small amount. And it was like, great, you just cost us $30 million to save us
yeah.
250.
Okay. Sorry. I gave you the wrong story. So that was
No,
the story.
both stories are great.
That was my leadership story because when you learn how important a leader is in a moment like that and affecting a change like that, it's so impactful. Yes. So he also had come up through sales and commercial. So he totally got the cost of development time. And he's the one who taught us what every month of delayed development cost because we endlessly debated for 6 months over probably $100,000. And I don't mean $100,000 isn't a lot of money. But when they presented this as this wonderful achievement, he said, great. So it took you 6 months to get 100,000 and 30 million a month. You cost me 150 to get 100. Can I just ask that you think about what's your end game? Like, are you having the right conversations? And please remember that every month costs us 30 million, but it costs some patients their life or their quality of life. So he's always careful to have the corporate and the patient balance. And I'll tell you, you probably won't meet anybody in the halls who doesn't know that time is of the essence for both patients and for money. And by the way, he also told us that any money we save is the money that lets us take another molecule off the shelf and develop it. So any wastage is delaying yet another molecule and another set of patients an opportunity.
Well, and Tracy, one of the things I admire so much about Thermo Fisher is, making an investment in something like this that some people feel like could be a nice to have, right? When you're under pressure and you have all the line items that you have to deliver, why is this not a nice to have? Why is it something worthy of investing in?
I think it brings it back to, when you're doing any type of root cause analysis, Steve, and you're understanding, where some of the pain points are. Why are we not being as successful as we need to be? Why are we not accelerating timelines the way we need to be? Why do we have, escalations, every month? When you do that root cause analysis and it takes you back to if the team had worked smarter, if they had worked together and talked through exactly what was going on, they may have had a different outcome. They would have been able to have found the solution. We want to empower our teams to be successful. And so the investment from Thermo Fisher is if the root cause shows us that there's a team and behavior element there, then we need to course correct. And so that was the investment that they made, and it has proven to be successful. So, we're thankful and very grateful that, Thermo Fisher support what we say when we're looking at this, because they want the same outcomes as us. If we deliver these trials either on time or early, then we're getting that drug to patient quicker.
Yeah, and we're talking about such a complex, highly regulated industry. I know everybody watching this thinks they work in a highly regulated industry. When I work with financial services people, are like, we're so complex. We're so, when I work with tech people, everyone thinks like in the case of pharma, like it really genuinely is. I mean, again, every industry has its own challenges, but like it really is a very, very challenging industry. And each part of the process introduces new potential for challenge with teams, right? Because we've been focusing this conversation on, the clinical operations and kind of clinical trial side, but then you have manufacturing, you have distribution, you have clinical services, you have all these different pieces, and each piece there is a new opportunity for friction and a new opportunity for other people to be kind of introduced and to have those challenges. And so I think one of the great parts about what you're doing at Thermo Fisher as well is you have that opportunity to invest kind of end to end in that teaming to help not just teach people and empower people to be great team members, but to offer this kind of full suite of services so that those team members follow the life cycle.
Yes, absolutely. And, Thermo Fisher are fully invested in ensuring that, we're finding those solutions. And as you said, whether it's in comparator, distribution, labeling, central labs, or clinical supplies, that end-to-end solution is what makes sure we get to market quicker.
So Tracy, for people who are watching right now who are maybe feeling a little bit inspired or a little bit hopeful around, ooh, this sounds like this could be something that could be useful in this environment. What is your advice to somebody who's saying, I don't think we're investing enough in teaming right now, and I want to get started on that journey? What advice do you have for them?
I would say, take the time, to reach out to Steve or to Wendy or to I mean, we've been here, we've lived this journey, over the last few years. We've seen the results. We have success stories that really show how this has worked and what an amazing job this has done. And so take the time just to, to be curious, to look into this a bit more. And I'm sure that we'll be more than willing to help you understand exactly why this could benefit your industry. And it may not be, in clinical trials, it may be in something else, but this can be done in any industry.
And Wendy, same question. What's your advice to somebody who's thinking about teaming and like doesn't know how to get started?
So when they tell me they don't have time, I tell them they don't have time to not do this, because the pullback, the savings, the benefits, it's almost like delayed gratification. You have to invest the time and the energy, and then when you get to the other side, and you're only going to have to get there once or twice, and you will know the value of it. What you can look back and say, I avoided all those cars in the ditches, all those crises, all those pauses on our programs because things got out of order or teams didn't work together. So My main message to people today is I'm a big fan of process and digital and data, and that's the focus, right? Everything's digital and data and process. That's not what delivers your work. The people who use that digital and data, the people who use those processes and how well they play together is actually the determining factor of the success of your programs. So to me, that's you have to look after your people. Engagement hasn't moved from 32% in 20 years. Only 30% of your people are saying, I'm excited to do a great job. The rest are doing what they need to do to get their paycheck, or worse yet, they're working against you. When you invest in teaming, you not only get better teams, you get better employees because they feel valued, they feel seen, value, and heard, they feel developed, they feel like they matter. So to me, that's why I named my company Change by Connection, and it's people power. People are the secret sauce, and we need to wake up and, invest. Stop saying they're our most important asset and start acting like they're our most important asset.
Wendy, if you were to reflect, I know I didn't ask you to prep this one in advance, so I'm putting you on the spot. But if you were to reflect on one of your favorite teams that you had a chance to work on in your career, and you think about, outcomes that you're really, really proud of like super difficult, situation, complex, high stakes. Can you take us into that story a little bit and talk about like kind of what was it, what was that team and kind of what was the goal and like why are you ultimately proud of it?
Yeah. So the team that taught me, started me on this journey was also at Takeda early in the career. It was a different partner. I won't name them, but I was called into a meeting with my boss, my boss's boss, and my boss's boss. And we were talking about how my partner was failing and we needed to move this project to actually Tracy's team, which someone else had at the time, to PPD. Um, and, my boss's boss looked at me and said, well, Wendy, what do you think about this? And I said, the fact I'm just hearing this now in this room is a big problem because I haven't even had an opportunity to help them be a better partner because it was a secret and we just let this sort of get off the rails. So my ask would be give me a couple weeks to talk to both sides of the equation and see what's going on and see what I can do. So by decompressing that, and it turns out that PPD has a process where they decide if they're going to get involved or not with the project. And I don't think they were keen to rescue it anyway. But so thank you for that in retrospect. But the reality was just getting people in a room talking and giving them the opportunity to be heard. And my strategy was half hour, you get to just vent your spleen. We talked about those respite moments, just let it all loose, right? And what I was doing was listening for themes as they were complaining and kvetching and getting it out of their gut. I could see the themes start to float up above the team. And came back to demeanor, mindset, disposition. And then the second half hour was no more complaining. Now we talk about, so what are we going to do about it? And it was so powerful for that team to just have that little moment to say, okay, yeah, we got it all out. And I played back what I heard to make sure that what I heard was what they intended. And did that with both sides. I then brought both sides together and brokered the conversation. What I'm proudest of for that team is not only do we not move the project, that team actually went on to over deliver early, and they had a regulatory submission delivery over Christmas break. That's the kiss of death in this world, right? Everyone's got plans, everybody's going away. That team came together on their own volition and made a plan to delay their Christmas holidays for key members. We negotiated with leadership to let them have vacation later. And the key was to let their families know that their holiday was going to be disrupted, not at the last minute, not promoting them being dissatisfied. It was a problem, but the fact they knew, and in January they could have a bigger one with a bonus on top of it, that really went a long way. And the team came up with that. They delivered that submission early over the Christmas holidays, and it did come to approval, which no one can guarantee, obviously. But my point was that showed me the power of teaming and talking to a team and coaching and nurturing them, because they went from a delinquent child who needed to be kicked out of school to a team that delivered a critical molecule for Takeda at the time, a critical submission, and did it through one of the most complex periods of time. And that's when I said, this is powerful. We need to do this with every team. We don't need to not do rescues. We need to let's set them up to succeed.
Kudos and congratulations to you and that team on, pretty incredible outcomes coming from a tough spot. Tracy, same question, putting you on the spot when you reflect back on, I mean, all the different teams you've been a part of and you've had the chance to be working with in this space. What story comes to mind for you as a team that you're just really proud of?
I think that's difficult because there are many teams that I'm proud of, throughout my career, within this industry, over so many years. But there has been a particular occasion where, there were team dynamic, issues that were taking place and they weren't collaborating, they weren't working together. There was that blame mentality and they just weren't moving forward the way they needed to. And so by implementing, this type of construct, it helped them understand that there is no them and us in this. It takes me back to what I said earlier, that one team mentality, being able to openly sit down and discuss what are those pain points, not blaming anyone, but what do we need to do differently to deliver? And it took some time, don't get me wrong, it wasn't one conversation and the problem was solved. It took time, but invest in that time and allowing that team to have that open forum, having someone to help facilitate and support them and give them other opinions and saying, well, I heard what you just said, but also I've heard what this one just said. When you look at that differently, can you see how it could be perceived in a different way? And so just spending that time with that team allowed them to really take a different approach. And the end result was, they started working together and they achieved what they needed to achieve. Whereas, 6 months before that, it looked like, this train had gone completely off the railway and there was no way it was going to be back on track. So, this is a true success story.
Yeah, and kudos on that as well. As we get prepared to wrap up here, if you can believe how fast the time goes, one of the threads that I wanted to pull on something you just said, Tracy, was kind of the importance of that, like, hey, someone being able to come in and take a fresh look, kind of an unbiased perspective. One of the things that some people might be thinking watching this is like, okay, this sounds good. Like, I think we can do this ourselves, right? And there are pros and cons to kind of any form of doing this. Why, in your experience, is it helpful to have kind of an unbiased third party come in and help with this kind of teaming work?
Because, that third party is on the outside. Everyone else is so involved and so intimately into the detail that sometimes, you don't really see what's right in front of your nose. And so bringing in that third party to really listen and to watch and to spectate and then be able to pass opinions on what they see as the outsider looking over the fence, is that opinion means so much more because the people involved are too close to it. They can't see what actually is happening because they're intimately too involved. So bringing in that third party who's able to listen and then collate what they've heard, but then also say, what about these as potential outcomes or solutions, is where the value is.
All right, and so some closing thoughts, from a triumvirate of folks who've had the chance to work together now for 5 years, doing everything from designing teaming assessments, right, across multiple pharma partners, across multiple CROs. What are the assessments? What are the data points that we understand to be true around the behaviors for how people show up? From designing various interventions with teams, whether it's at the outset, if it's the close, if it's kind of spot checks, we've had the chance to do those things together. Whether it's designing a systemic approach to teams, right, we've had the chance to do those things together. We've been in the trenches with teams a lot, and we've covered a lot of ground today. Wendy, closing thoughts for the group of just the most important things that you would want to reinforce from today for people to be keeping in mind.
So the closing comment I give to every team I work with about why it's important to set yourself up intentionally to be successful is it's a complex, rapidly changing world. It's like no world we've ever lived in before. Data's flowing at us. What we know today is going to look different tomorrow. So there is no set roadmap that's just going to be successfully executed. without a sort of a surveillance mindset, without being actively involved. And so I always say to them, it's a complex, rapidly changing world. When things go wrong, and they will, because it's a complex, rapidly changing world, don't blame each other. Turn on that with curiosity and seek to understand what transpired, what happened, and what do we collectively do about it. Because the second that emotion creeps into that equation and you start pointing fingers, or you start getting anxious, or you start, who's going to tell the leaders? The reality is the reality. Own it, get in there, take a decision. And you get a team to operate that way when you help them set themselves up intentionally to do that. Otherwise, you get a mixed bag of old habits that usually aren't helpful, and you haven't set yourself up to really be ready for, it's going to be a rocky road. It's going to be crazy. So form, storm, norm before you have to perform in a complex, rapidly changing world. That would be my best advice around why you want to invest in teaming and why you want to invest in yourself to be the best team member you can be.
And Tracy, closing thoughts for the group coming out of your birthday and your anniversary and all of the successes. I know that can be a kind of reflective time of year. So your closing thoughts for the group.
The industry is continuing to evolve, as we do as people, and there are always outside factors that influence everything that we do every single day. I think, the words that Wendy used, be curious, partner together, trust one another, and really look to one another to be one team rather than a vendor or a client or the CRO or the central lab. Understand that we all have to do the same thing here, and therefore, being open and transparent with one another will bring the results that we're looking for.
I agree completely. Great. Transparency and alignment, two of our favorite words.
Yes.
Well, I can't say thank you enough to both of you for being part of this conversation today, for the journey that we've been on together and the journey that I know we'll continue to be on together for years to come as we support teams like this. At Cultivate, we are so committed to this in terms of how do we support teams to be successful. And so we continue to expand our offerings and kind of the ways that we support teams in this way, because we know it's just a very, it's a very under-supported space right now, I think. I don't see a lot of people talking about how are we supporting these high-stakes teams, how are we supporting these clinical trial teams, and going in with super intentional interventions and super intentional support. And we're excited to do that. And we're excited to do that, in the pharma space and the med device space and kind of the different spaces that it makes sense. So again, thank you both so much for taking the time today, and we look forward to hearing from folks out there about your experiences and your questions. Have a great day.
Thanks. Bye-bye.
Thank you. Bye.